I have seen books talk about using the D door, the force on out from Ren 4, and you use at least a 50, 60 mil needle and you go through from it through Zhejiang and keep heading towards the Ren channel on that diagonal sort of angle. But that's certainly more advanced. And if you're not used to doing that type of needling, you probably want to see it done first and practice it with someone that's experienced in that area. Now, endometriosis also needs to probably have a core set of points apart from that, and those are large intestine 4 and spleen 8. In my opinion, you just have to have those both in. And then you choose some other points. And you'll notice spleen 4 and peri 6 or lung 7 and kidney 6 or small intestine 3 and bladder 62. And I said to you earlier, the 8 extraordinary vessels are really, really important for men's and women's health. And when you look at the one at the top of the list, spleen 4, peri 6, for women's probably the favorite in most books that you'll read. And if there is research done on the different women's health conditions, you'll usually see the spleen 4, peri 6 pop up as the Chong Mai special combo. Otherwise, the lung 7, kidney 6 will do the Ren, or small intestine 3, bladder 62 will work on the Do. If you did small intestine 3, bladder 62, maybe you'd flip them and do a face down treatment as an option, because you can then target a few Do points as well. But that's the idea. You're doing Ren 3, 4, 6, and Zhejiang bilateral. So that's 3, 5 needles. And then you do large intestine 4 and spleen 8 as well. I do them bilateral. That's now 9. And then you choose, why have I got 12 there then? 2, 4, 6, 8, 10, 11, 12, 13, 14, 15. Yeah, 12 needles bilateral is a mistake. Sorry, there's usually always one typo. So you would have 2, 4, 6, 8. If you did these, any of these ones, that's 8 needles, 9, 10, 11, 12, 13 needles in total. Yeah. So that's how I would work it. And personally, probably the spleen 4, peri 6 first. Yep, already talked about all that. So explained everything there. So the large intestine 4 and spleen 8 is if there's any pain at all, they're the crackerjack point combo for pain. Even if they're not feeling pain, they usually feel some pain at some time. And so you can still use them outside of the pain. So if they come in without any, I'd probably still use them. I consider it to be like it holds it in reserve. So the Chi's there ready in case they start to get some pain a few days later and they're not in for treatment, they still will work. All right, the next one is PCOS, or polycystic ovarian syndrome. Kidneys tend to be the one that's mostly mentioned, and the water element. And that will either be solo or can be combined with spleen or liver, sometimes some other organs as well. But that's often what you're going to see. Now, again, like endometriosis, you typically see it as a deficiency of pretty much anything or a stagnation of pretty much anything. And the Shen, based on the signs and symptoms of polycystic ovarian syndrome, it shouldn't be surprising that the Shen is involved as well. Again, that type of thing's outside the scope of the subject, but you'll see there with this, there's a list of symptoms that are mentioned there. And even Western medicine acknowledges mood changes. It's interesting, the reference point, cannabis for PCOS. I just thought it was a good picture to use. I don't say that cannabis should be used for PCOS, but maybe they're doing clinical trials on it, and we'll see in a few years' time if it was any good. Now, what's very important is, from my experience, and this could possibly be a quiz question, PCOS for me is stagnation more often than deficiencies. If you are different because of your clinical experience, that's great. But for the question, you definitely need to be aware that it's stagnation more than deficiency is what I see. because look at the words. Polycystic ovaries. Poly is too much, cysts on the ovaries. So what are the cysts in Chinese medicine? They're too much of something stuck. So it's too much phlegm, it's too much damp, it's too much blood, it's too much qi, creating stuckness in and around that lower jiao region, specifically the reproductive system. So it could also be damp heat in the liver channel. Don't think I've ever diagnosed that with PCOS, but it's definitely one that is mentioned. Damp heat in the liver channel, for me, is much more likely to be a male-based health issue than for a female. But again, that's just from what I've seen in clinic. And I think what we need to bear in mind is that we're all in different parts of the world. That's kind of what's so exciting about this webinar today. And so depending on where you live, the people you treat, you're going to have different diagnoses, different types of treatments that you'll want to undertake. I mean, I remember specifically something I never forgot. I read Giovanni's Foundation's first edition back when I was studying, and he said the most common pattern he ever ran into was spleen qi deficiency. That's based on where he treated his patients most, which was in England or in northern China. I live in Brisbane. It's hot. It's hot, and people get stressed. So my most common pattern that I diagnose is liver qi stagnation. It's not spleen qi deficiency. So depending on where you live, who you treat, you're going to get different diagnoses. But that's what I see. PCOS is more stagnation than deficiency. Again, stacks of points. Looking at that list, I'd be hard pressed to not do face up here, but I am trying to give you a variety of options. So I may be giving you a face down, but we'll check that in just a minute. I hope Sandro doesn't mind, but I saw an amazing workshop that he presented at the Dow Congress in Graz in Austria only, when was that? Maybe a month or so ago. And it was actually on PCOS. And so some of the points that are listed were from a top 10 that he collated with all of his clinical trial research that he does that I'm not very good at. So what I'm good at with research is hitting the books and finding lots and lots and lots of information. I'm less good with the clinical trials. So thank you, Sandro, for that wonderful workshop and the points listed. Oh, I did do face up again. I mean, look, to be fair, it is the better option in my mind. And when you look at this, it's a bit similar to the last one in that I'm trying to give you core level points. So in this instance, we've got 3, 4, 6, and 12 of the REN. Regardless of whether it's deficiency or stagnation, REN 12 is still good, but it's better for deficiencies than stagnations. Stomach 28's a belter for this, and so is the zigong. So this is really interesting types of needling. And if you don't know how to do this, then probably just needle them perpendicular or whatever angle you do them on. Again, any of these points are in the tummy. So if you did perpendicular too far, you're going to run into a lot of trouble. But this is a really, really interesting kind of design. What you do with stomach 28 is you thread it towards zigong, and then with zigong, you thread it towards the REN. And they are on diagonals, and they are oblique transverse needling. Does that make sense? So they're not medial or lateral needling. They are on diagonals. So as you needle stomach 28 towards zigong, it's going to go out on a diagonal, because stomach 28 is 2 sun out from REN 4. So it's 2 sun up from the pubic bone, 2 sun out. And then zigong is 1 sun up from the pubic bone, 3 sun out. So you would needle stomach 28 on a diagonal out, and then zigong is a diagonal in. So you get this kind of funky looking design happening on the tummy. But what it's designed to do, then you've got the points on the midline, is you're getting energy flooding that whole space. I remember also watching a workshop, 2 workshops actually, from Lorne at the same Congress in Austria. And he talked about using laser. Another really fascinating conversation for another time. But the laser, he was really, when he was talking about women's health, he was really keen on trying to get the laser to penetrate deeply into the lower abdomen. And this is another way of looking at doing it with the needles. You may also use laser, but this is trying to get the energy really moving through large sections of that lower abdomen into the reproductive system. So you've got that lovely little funky design on the tummy, or you just needle them perpendicular or whatever angle you do it on. Then I believe that you should have spleen 10 and stomach 36 in every diagnosis of PCOS. Spleen 10 is going to move the stagnation, specifically blood, and stomach 36 will move energy into the area, but will also act as a good tonifier. So it will move and tonify. And then you choose an 8 extra. So this is the Chong again, or the Ren, or you might use the dye this time. You could still use the Do as well, but that's your choices. And again, everything that I just explained on that slide is everything that I just talked about on this slide. So don't need to go into this again.